everybody. I'm Shannon Koss. I'm a physician assistant with Bellin Titletown Orthopedics with the joint replacement team, and I particularly work with Dr. Kleist. Today I'm going to be talking to you about how to reach your goals. I'm also going to kind of go into pain management, and that goes all together anyway. So this will coincide with the binder that you're looking through, and I've kind of gone through everything and picked out what I felt was the most important for you to focus on. I want you to remember that this is no fun initially. This is going to be painful initially, and you've got a lot of hard work ahead of you, but I want you to keep your chin up, and I want you to keep your eyes on the finish line. And with your good attitude and our teamwork, we're going to help get you there. So the first thing that I thought was important for you to help reach the goals that you're working toward is to read the paperwork that we give you, especially when you leave the hospital. We have lots of paperwork and we spend a lot of time putting information in there for you. Specifically, I want you to look over the medications that we wrote. I have specific instructions on there about when you might need to stop something or start taking something, how frequently you need to take a medication. So really pay very close attention, especially to the new medications that we put on there. As far as pain control goes, there's nothing that we can give you that will take all of your pain. Our goal is to make it tolerable for you. So take the medications as scheduled, especially initially. Don't wait to see how bad it gets. Just keep taking it on a regular basis. Our goal also is not only to control your pain, but we also want to make sure that we're weaning you off of things down the line as we get farther from surgery. So if you need more narcotics, you give us a call. I want you to make sure you give us at least a day's time so we have time to gather the information, send it off to your pharmacy. And I want you to do this Monday through Thursday. We refill on the evenings or weekends or holidays, so do look in advance and make sure that we can get things ready for you. The next important point I want to talk about is elevation, and I feel like this is extremely important, and we get lots of phone calls about this. Your leg will swell. To help that the best you can, I want you to make sure that you're elevating appropriately and doing it several times a day. To elevate appropriately, I want your back to be flat, which means you have to lay on the bed or the couch. I don't want you doing it in a recliner because you can't do a good job. So when your back is flat, I want you to put that leg up on 4 pillows so it's underneath your ankle and now your toes are above your heart. Stick some ice on your hip or your knee and be there for 20 minutes and do it several times a day. If you feel that you're getting more swollen, you've got to do it more often. And I think the thing that people get more concerned about is, oh my goodness, my leg is swollen. Do I have a blood clot? Signs of a blood clot would be a very swollen calf. It's red, it's shiny. You can't imagine somebody coming close to it to squeeze on it because it's just going to hurt so bad. Those types of things, you give us a call. We'll talk through it with you. But if you can keep your swelling controlled, you're going to be more comfortable and your motion's going to come along better. Third thing, this is especially for the knee replacement patients I'm talking to right now, is you've got to do your exercises. We've done your surgery. We've got the first step out of the way. But now it's your time to shine. You will gain the bulk of your motion in these first 6 weeks. To get a good outcome, you've got to hit it hard. It's going to be uncomfortable, but you've got to find a way to medicate yourself, take a pain pill a half an hour before you go in, have good imagery, breathe through it. This is your time. Work hard. Next is talking a little bit about appetite. You're not going to have a very great appetite initially. I feel that that's a combination of anesthesia and pain pills. What I'd recommend is don't try to eat the three big meals a day. You're not going to want to do that. Your belly's not going to feel good with that. So I say graze all day long. Try to make healthy choices. Veggies and fruit, that'll increase your fiber. That'll help with constipation. If you have little bits of meals all day long, it means you'll have a little food in your belly for your pills, which will decrease your nausea. And then just by making healthy choices, this will improve your nutrition to help you heal better. Something else I want to point out is we're going to say drink lots of fluids. And I don't mean hitting it hard with only water. I want you to add in electrolyte drinks, whether that's Gatorades or Pedialytes, or sometimes you can get little packets of electrolyte combinations to put in your water. You could do some broths. All of these things will help to adjust your electrolytes, which can also decrease some dizziness that you might be having as well. Next topic is on sleep. You're not going to like us initially. You're not going to sleep well. That's the case for many people, and this is usually for a few months. It's just your body's response to this trauma or stress of surgery. It will get better. So don't get focused on the fact that you're not sleeping. Instead, I'd recommend avoiding napping throughout the day. Try to stay active. And even by that, I could mean, yes, take your walk every hour around the house, but try to stay mentally active as well. If you like doing puzzles or reading or talking with friends, just try to keep your brain active, and that might just help make that nighttime go a tiny bit better. Next, I like to point out that depression and anxiety, these can be very common things after surgery, not even for people with a diagnosis, but even for people that don't feel that they have these issues or problems. I feel like it's a lot to do with you're losing some independence initially. Everything is just harder initially. You're having pain, you're not sleeping well. Just pay attention to these symptoms. Do things to make yourself happy. Whether, again, that's visiting with friends, or if you like reading or watching a movie. Do things that kind of fill your bucket, make you happy. And if you feel like you're slipping to a place you don't like where you're going to, contact your family provider and just talk with them and let them know what's going on. My last point is, of course, you want to be free of any infection. So how do you look for this? You just look at your knee or check out your hip in the mirror. Anything that you see that's different, you notice leaking through the bandage, or boy, this is getting more swollen and I'm elevating all the time. Maybe it's redness or worsening pain or warmth or fevers or chills, or you just feel uck, just call us. We'd be happy to talk through things with you. So I think that those are the most important parts as I looked through your papers. Obviously, there's going to be more that you're going to see. I want you to remember, this is tough initially. This is a marathon recovery, and you've got to put a lot of work in it to get a good outcome. But remember why you're doing this. I want you to keep your chin up, keep your eyes on the finish line, and remember that we're here for you.